For a population approximately 1.2 crores, Bengaluru has 385 reported COVID-19 cases as of June 1st. In comparison, Chennai has over 15,000 cases, New Delhi has over 20,000 and Mumbai has over 40,000 cases. So how did Karnataka swing this miracle? Was it sheer luck or was there a Bangalore model that worked? According to experts, the steps taken to prevent the virus in Karnataka, like tracing, tracking, treating, etc., were similar to other states, but the difference wasn't the implementation. So here is how Bengaluru managed to achieve such low numbers. The first smart step taken by the Karnataka government was to allow the experts to run the show. The bureaucracy did not interfere with a team of experts advising them. Dr. Giridhar Babu, who is part of the Karnataka Technical Advisory Committee, told the Quint that the trust and independence given to the team was astonishing. According to him, at no point proposals made by the technical committee were ignored by the health department. The second step was effective contact tracing. Bengaluru reported the first COVID-19 case on 8th of March. In the days that followed, the health department and the BBMP prepared a list of 2,666 people who might have come in contact with a techie who had just returned from the US. Over a month, these contacts were quarantined and monitored to make sure they were not showing any symptoms. The cases that followed did not have such a large number, but on an average, Karnataka traced up to 46 contacts of every COVID patient. Apart from effective contact tracing, testing the right people also helped the state reduce the numbers. On 15th of April, Karnataka passed an order to test every person showing symptoms of influenza. To help this entire process, they asked medical stores to keep the contact numbers of anyone buying medicines for these ailments. Similarly, Karnataka is conducting a massive door-to-door survey across the state to find out if anyone has any symptoms that could lead to COVID-19. So far, 72% of the state's households have been covered under the survey. The third and possibly the most important step taken by the Bengaluru administration was getting the containment zones right. Their inability to control clusters like Dharavi in Mumbai, the Coimbatore market in Chennai, and the Tablighi Jamaat conference in New Delhi resulted in the respective city administrations losing control over the COVID-19 cases. But in Bengaluru, the administration was able to control the clusters much better. The BBMP takes pride in arguably introducing the concept of sealing of an area. On April 10th, BBMP officials physically sealed off Padarayanpura, a locality in West Bengaluru, after it was identified as a high-risk area. This decision paid off in the months that followed after it was found that 23.6% of total cases in Bengaluru came from Padarayanpura alone. This area still remains sealed off. In the last week of May, officials conducted 400 random sample testings in Padarayanpura and they all came negative. Apart from effectively sealing of containment areas, Bengaluru also saw one of the strictly implemented lockdowns. According to Bengaluru police, more than 50% of the main roads in the city were blocked off to avoid any unnecessary movement of traffic. The checkpoints across the city also ensured that people did not come out of their houses during the lockdown. And finally, efficient use of technology. As mentioned earlier, effective contact tracing helped Bengaluru reduce its numbers. And for this task, more than 2 lakh government employees were deployed across the states. As per the earlier process, when a COVID-19 patient shares his contact details and if one of the primary or secondary contact was in a different district, a letter had to be sent to the collector and then further inform the person on the ground to track the contact. As this was taking time, the government introduced an app. Under this app, any information collected by any of the workers is uploaded into a cloud. And this information is directly provided to various workers working on ground levels in various districts, making the process of contact tracing much faster and easier. While these steps have helped Bengaluru administration keep the numbers in check, the job is only half done. With the borders opening up, more people are expected to come to a city and the administration will have a bigger job in its hand. According to expert, three main steps have to be taken to make sure that the numbers don't rise. First, expand the list of symptoms of COVID-19 to add loss of smell, loss of taste, muscle pain, and weakness. And with these, test more people and isolate more people. Second, to identify clusters quickly and isolating them. And third, testing as many symptomatic people as possible to identify super spreaders.